the news that everybody's waiting on?
Well, Marc underwent surgery on the 20th for a non-displaced type 2 fracture of the navicular bone in his right foot. All the prognosis so forth are very encouraging. We expect him to make a full recovery, very confident about that, and expect him to, when he makes a full recovery, rejoin his status as one of the elite centers in the NBA.
Chris, obviously big men dealing with foot injuries is kind of a scary topic around the NBA. What do you guys, I guess, how difficult will it be to exercise caution and make sure Marc stays patient through this rehab process?
Well, Marc's going to be a terrific patient in the rehab process. One, he's an extremely intelligent guy, very sophisticated. He understands the protocol involved, and he'll do everything that our doctors have asked him, and no worries about that at all. There have been players come back from this injury before. There's one that you all know very well, Michael Jordan. I think you've heard of him. He came back and did quite well after this type of an injury, and it's definitely something that can be overcome.
Chris, can you explain the process and why he was in Charlotte or wherever in North Carolina?
Well, we had a an all-star team of doctors that did the surgery. Dr. Drew Murphy from here in Memphis at Campbell Clinic, and Dr. Robert Anderson out of Ortho Carolina in Charlotte, who's regarded as a foremost authority on the navicular bone surgeries in all of professional sports, maybe not just this country but the entire world. He's so we got the best care that was possible, and we're very complimentary of what they've done, and they're very optimistic.
Now, you mentioned Michael Jordan, had the surgery, but a lot of big guys, it's been very difficult to have surgery. Michael's a wing player. So a little bit about the concern about having, someone of Marc's size with other big guys having.
Well, the first thing is, Marc did not have a fracture, that was completely displaced or went through. He had a type 2, which is positive. And secondly, he's going to be a terrific patient. He's going to follow all the protocols. And there are many players, both in the NBA and outside the NBA, who have come back as good as new from this surgery. So we are fully confident that he'll be amongst those ranks when he returns to play.
Is this another injury that, obviously, technology in the medical field a lot better than it was in '85 when Jordan went through it? I'm sure that helps you guys as that kind of evolves.
Well, absolutely. I mean, the technology is greater than before. The surgical techniques, I mean, obviously from the surgical standpoint, I mean, we got as good as there could in the business out there doing this with the 2 doctors that were involved and consulted in the surgery. And Marc obviously is, I think, a very high-grade individual. He's been very dedicated to his body and his craft, ever since he's been a professional player, back even before he came to us with the Grizzlies. So he's going to be an ideal patient, and there's no reason not to expect him to come back and be the Marc Gasol who's been a dominating presence in this league for quite some time.
What is the mood and approach for the season, the rest of the year, now knowing exactly that Marc won't be back this year?
Well, I think our players and our coaches have been very upbeat and spirited about going out there and competing, holding their spot in the playoffs. The first 3 games, since Marc has not been with us, we've won 2 of those 3 games, obviously. We were very competitive on the road against Toronto, just didn't make enough shots. So I think everybody's very excited about the challenge of getting back in the playoffs for the 6th straight year. And I just love the spirit that I've seen and camaraderie from this coaching staff and players so far.
What can you tell us about the rehab process he'll have to go through? And is there any kind of timetable yet for you guys?
No, there's no timetable. It's just it's a process that has to be handled carefully, very deliberate, and Marc will do that.
Chris, the care that you need to some extent for Marc has always been in the Olympics and playing well. He was sat out. That typically you're talking 4 to 6 months, and that's a care out there.
We'll put a timetable. We'll deal with the Olympics. We'll deal with the Olympics when at the appropriate time.
But you encourage
right
him
now,
to maybe
we'll deal with the Olympics at the appropriate time. Right now, he's had the surgery, laying out the rehabilitation process. Everything's going fine so far, and we'll deal with that at the appropriate time.
On a personal level, since you've been so involved with Marc as well.